Hello! In this video, we are going to answer the practice questions about drugs acting on respiratory system. Question number 1. Drugs that help suppressing or relieving coughs are called A. Antitussives, B. Bronchodilators, C. Cough suppressants, D. All of the above. The answer is A. Antitussives. Antitussives connotes counteracting or effective against, while tussis is the technical name for cough. Question 2. Drugs which relax the smooth muscles of bronchi are called A. Antitussives, B. Bronchodilators, C. Cough suppressants, D. All of the above. The answer is B. Bronchodilators. Bronchodilators cause dilation of respiratory passages and help in relieving bronchial asthma and acute respiratory distress. Question number 3. Drugs that increase the fluidity and volume of bronchial pulmonary secretions and help in their easy expulsion through productive coughing are called A. Bronchodilators, B. Cough suppressant, C. Analeptics, or D. Expectorants. The answer is D. Expectorants. Expectorants are ingredients that increase airway secretions. They do this by increasing the water content of the secretions, which decreases their stickiness, making them easier to cough. Question number 4. Drugs that stimulate the depressed medullary respiratory center, or MRC, to relieve respiratory insufficiency are called A. Bronchodilators, B. Cough suppressants, C. Analeptics, D. Expectorants. The answer is C. Analeptics. Analeptics is an anesthetic recovery tool or to treat emergency respiratory depression. It stimulates the depressed MRC due to overdosage of anesthetic and other CNS depressants. Question number 5. The function of central acting antitussives is to A. Suppress cough through direct depression of medullary cough center, B. Depress the tracheal and bronchial afferent sensory nerves and pulmonary stretch receptors and thus prevent their activation of medullary cough center. Letter C. Helps promote pulmonary drainage during inflammation of respiratory tract. Letter D. Exerts local anesthetic effect on cough receptors in the respiratory tract. The correct answer is A. It suppresses cough through direct depression of medullary cough center. Centrally acting agents such as dextromethorphan work by inhibiting the cough center in the brain, elevating the threshold for coughing. Opiates also work through a central mechanism. Question number 6. A peripherally acting antitussive, which is chemically related to tetracaine, exerts local anesthetic effect on cough receptors in the respiratory tract. A. Codeine, B. Folcodeine, C. Benzonatate, D. Noscapine. The answer is C. Benzonatate. Benzonatate is an oral antitussive drug used in the relief and suppression of cough. It works to reduce the activity of cough reflex by desensitizing the tissue of the lungs and the pleura involved in the cough reflex. Question 7. A codeine alternative which has a longer duration of action. A. Codeine, B. Folcodeine, C. Benzonatate, D. Noscapine. The answer is B. Folcodeine. Folcodeine has antitussive activity similar to or somewhat greater than that of codeine in animals. Preclinical toxicity studies demonstrates a generally safe profile for folcodeine than codeine. Question 8. A central acting antitussive which is also called methylmorphine. A. Codeine, B. Folcodeine, C. Benzonatate, D. Noscapine. The answer is A. Codeine. Codeine is methylformine. Methylation of morphine significantly improves the oral bioavailability by reducing the first pass effect. Question number 9. It has a smooth muscle relaxant with neither narcotic nor addiction properties but has antitussive action like codeine. A. Codeine, B. Folcodeine, C. Benzonatate, D. Noscapine. The answer is D. Noscapine. Noscapine is a benzylisoquinoline opium alkaloid that acts as a smooth muscle relaxant. It does not have any narcotic properties and does not cause addiction, but it does have an antitussive action similar to codeine. In high enough doses, it triggers the release of histamine. Question number 10. Its actions are not through opioid receptors and may be directly depressing the cough center. A. Butorphanol, B. Dextromethorphan, C. Hydrocodone, and D. Folcodeine. The answer is B. Dextromethorphan. Dextromethorphan is technically not considered an opiate because it does not bind to traditional opiate receptors and is not addictive or analgesic. It is the D isomer of levorphanol. Question 11. An opioid agonist-antagonist with more potent analgesia than morphine and antitussive action than codeine. A. Butorphanol, B. Dextromethorphan, C. Hydrocodone, B. Folcodeine. The answer is A. Butorphanol. As an antitussive in dogs, butorphanol is 4 times more potent than morphine and 100 times more potent than codeine. At antitussive dosages, it may produce considerable sedation in dogs. Question number 12. An antitussive more potent than codeine. Letter A. Butorphanol, B. Dextromethorphan, C. Hydrocodone, D. Folcodeine. The answer is C. Hydrocodone. Hydrocodone is chemically and pharmacologically similar to codeine but more potent. It is combined with an anticholinergic drug to discourage abuse by humans. Question number 13. Drugs which loosen or break viscous inspissated pulmonary secretions to facilitate expectoration. Letter A. Antitussive, B. Expectorants, C. Cough suppressor, D. Mucolytics. The answer is D. Mucolytics. Mucolytics are medicines that thin mucus, making it less thick and sticky and easier to cough up. They are used to treat respiratory conditions characterized by excessive or thickened mucus, such as a chesty or productive cough. For items 14 to 20, identify the classification of expectorants based on mode of action. Question number 14. Increase respiratory secretions by about 400% reflexively through GIT. It also has an antitussive action and pain-relieving action. Letter A. Anodyne expectorants, B. Inhalation, C. Sedative expectorants, or D. Stimulant expectorants. The answer is A. Anodyne expectorants. Anodyne expectorants are a camphorated tincture of opium increase respiratory secretions by 400%. It acts by reflex action to the GI tract, causing elevation in output of fluid in the respiratory tract. Question number 15. It acts by stimulating mucus secretion and respiratory passages reflexively from GIT. A. Sedative expectorants, B. Stimulant expectorants, C. Anodyne expectorants, or D. Inhalation expectorants. The answer is A. Sedative expectorants. Sedative expectorants stimulate secretion of mucus, which protects and reduces acute inflammatory conditions in the respiratory tract. When coughing occurs, it is more productive and effective but less frequent. They have little, if any, antitussive activity. Question number 16. It stimulates and promotes repair of chronic inflammatory process. Letter A. Anodyne expectorants, B. Inhalation expectorants, C. Sedative expectorants, or D. Stimulant expectorant. The answer is letter D. Stimulant expectorants. Stimulant expectorants are used to stimulate or repair of chronic inflammatory processes. Many of these expectorants are aromatic compounds that probably are eliminated in part by the respiratory mucosa. Some of them tend to reduce bronchial secretions. Question number 17. A type of sedative expectorant where it increases mucosecretion in respiratory passage reflexively from GIT. A. Demulcent expectorants. B. Nauseant expectorants. C. Saline expectorants. Or D. Stimulant expectorants. The answer is C. Saline expectorants. Saline expectorants are claimed to stimulate bronchial mucus secretions via a vaginally mediated reflex action on the gastric mucosa. Question 18. A type of sedative expectorant that have a smoothing action in upper respiratory passages. A. Demulcent expectorants. B. Nauseant expectorants. C. Saline expectorants. D. Stimulant expectorants. The answer is A. Demulcent expectorants. Demulcent expectorants protect the mucosa of the respiratory tract from irritation and so reduce their frequency of cough. Example of these is syrup of Vasaca. Vasaca is an expectorant. Alone, syrup has no expectorant value. It does not increase fluid secretions of respiratory tract but may serve as a vehicle for an expectorant drug. Question number 19. A sedative expectorant where it increases respiratory secretions by producing nausea. Letter A. Demulcent expectorants. B. Nauseant expectorants. C. Saline expectorants. Or D. Stimulant expectorants. The answer is B. Nauseant expectorants. Nauseant expectorants increases secretions of the respiratory tract by producing nausea, which serves to loosen a dry, harsh cough. Question 20. It increases the bronchial secretions by direct local action. It gives relief in chronic respiratory disease. Letter A. Sedative expectorants. B. Stimulant expectorants. C. Anodyne expectorants. Or D. Inhalation expectorants. The answer is D. Inhalation expectorants. Steam can also help break down mucus, causing a chesty cough and help you to cough it out. But care should be taken to avoid burning yourself with hot water or steam. For items 21 to 30, identify the classification of bronchodilators based on mode of action in relaxing the bronchi. Question number 21. Examples of this classification are B2 adrenoceptor agonist, ephedrine, and epinephrine. Letter A. Antihistamine. B. Xanthine. C. Sympathomimetic. Or D. Cromolyn. The answer is letter C. Sympathomimetic. Agent that stimulates sympathetic nervous fibers, which allow relaxation of smooth muscle in the airway. Question number 22. It has a direct relaxant action on bronchial smooth muscle and inhibition of phosphodiesterase with resultant in increase in CAMP. A. Antihistamine. B. Xanthine. C. Sympathomimetic. Or D. Cromolyn. The answer is C. Xanthine. Xanthine derivatives ease symptoms of bronchospasm and make breathing easier by relaxing the smooth muscles of the respiratory tract and reducing the airway's hypersensitive response to stimuli. Question number 23. Its bronchial relaxant action believed to be multifacial. A. Antihistamine. B. Xanthine. C. Sympathomimetic. D. Cromolyn. The answer is letter D. Cromolyn. Cromolyn is used to prevent the symptoms of asthma. When it is used regularly, cromolyn lessens the numbers and severity of asthma attacks by reducing inflammation in the lungs. Question number 24. Examples of this classification are promethazine and diphenhydramine. Letter A. Antihistamine. B. Xanthine. C. Sympathomimetic. Or D. Cromolyn. The answer is A. Antihistamine. Antihistamine can play a crucial role in managing allergic asthma. Allergic asthma, also known as atopic or allergy-induced asthma, is triggered by exposure to an allergen. Question number 25. These drugs increase ciliary actions in clearing mucus. A. Antihistamine, B. Xanthine, C. Sympathomimetic, or D. Cromolyn. Letter C. Sympathomimetic. Sympathomimetic drugs that influence alpha-adrenergic receptors have been used as therapeutic agents for decongestion of mucous membrane. Question number 26. It blocks cholinergic muscarinic receptors. A. Parasympatholytics, D. Cystenyl leukotriene receptor agonist, C. Prednisolone, or D. Anti-inflammatory agents. The answer is A. Parasympatholytics. Agents that block parasympathetic nervous fibers, which allows relaxation of smooth muscle in the airway. Same as anticholinergic bronchodilator agent that blocks the effect of the acetylcholine at the cholinergic site. Question 27. These drugs reduces the formation of cytokines. A. Parasympatholytics, D. Cystenyl leukotriene receptor agonist, C. Prednisolone, or D. Anti-inflammatory agents. The answer is D. Anti-inflammatory agents. Anti-inflammatory medications decrease airway sensitivity and reduce mucus production. Question number 28. It acts by preventing leukotriene-induced bronchoconstriction. A. Parasympatholytics, B. Cystenyl leukotriene receptor antagonist, D. Prednisolone, or D. Anti-inflammatory agents. The answer is B. Cystenyl leukotriene receptor antagonist. Leukotriene modifiers block leukotrienes, which cause allergy-related inflammation and congestion. Leukotriene modifiers prevent allergies and asthma from constricting bronchial tubes. Leukotriene modifiers work by blocking the action of leukotrienes, one cause of the inflammation and nasal congestion associated with allergies. Question 29. It inhibits the formation of thromboxane A2, levothyroxine, and leukotriene D4, and leukocyte chemotaxins, leukotriene B4, and platelet activating factor. A. Parasympatholytics, B. Cystenyl leukotriene receptor antagonist, C. Prednisolone, D. Anti-inflammatory agent. The answer is D. Anti-inflammatory agents. Anti-inflammatory medications decrease airway sensitivity and reduce mucus production. Question number 30. It is for the relief from chronic pulmonary obstructive disease in the horse synthetic corticosteroid analogs. A. Parasympatholytics, B. Cystenyl leukotriene receptor antagonist, C. Prednisolone, D. Anti-inflammatory agents. The answer is C. Prednisolone. Prednisolone is a glucocorticoid similar to cortisol used for its anti-inflammatory, immunosuppressive, anti-neoplastic, and vasoconstrictive effects. Question number 31. Aminophylline, a xanthine, is used to treat dogs. What is the recommended dosage? A. 8 mg per kilogram every 6 hours. B. 10 mg per kilogram every 6 hours. C. 8 mg per kilogram every 12 hours. Or D. 12 mg per kilogram every 12 hours. The answer is B. 10 mg per kilogram every 6 hours. Aminophylline in dogs is registered 10 mg per kilogram every 6 hours or 6 mg per kilogram at 12 hours intervals orally. Question number 32. What is the recommended dosage for prednisolone, an anti-inflammatory agent on horses? A. 0.5 to 1 mg per kilogram orally on alternate days. B. 0.5 to 2 mg per kilogram orally on alternate days. C. zero point 0.5 to 3 milligrams per kilogram orally on alternate days, or D. 0.5 to 4 milligrams per kilograms orally on alternate days? The answer is A. 0.5 to 1 milligrams per kilogram orally on alternate days. Question number 33. What is the recommended dosage for prednisolone on cats? A. 1 milligram per kilogram per day. B. 1.5 milligram per kilogram every 6 hours. C. 1 milligram per kilogram every 2 days. D. 0.5 milligram per kilogram per day. The answer is A. The recommended dose is 1 milligram per kilogram per day. Question number 34. Drugs which are also used in chronic obstructive pulmonary disease in horses. A. Analeptics. B. Bronchodilators. C. Hydrocodone. Or D. Butorphanol. The answer is B. Bronchodilators. Chronic obstructive pulmonary disease, or COPD, is characterized in horses by chronic cough, increased respiratory rate, forced abdominal breathing, and exercise intolerance. Treatment will often involve combined use of bronchodilator and corticosteroid drugs. For items 35 to 39, identify the type of analeptic being described. Number 35. An analeptic which is a drug of choice in emergency cases. A. Nicethamide. B. Doxaprom. C. Zofirlukast. Or D. Methylxanthine. The answer is B. Doxaprom. Doxaprom is used primarily in emergency situations during anesthesia or to decrease the respiratory depressant effect of opiates and barbiturates. Question number 36. An analeptic which is a first respiratory stimulant. A. Nicethamide. B. Doxaprom. C. Zofirlukast. Or D. Methylxanthine. The answer is A. Nicethamide. Nicethamide is a stimulant which mainly affects the respiratory cycle, widely known by its former trade name, Coramine. It was used in the mid-20th century. Question number 37. Examples of these drugs are caffeine, theophylline, or aminophylline that stimulates MRC. Letter A. Nicethamide. B. Doxaprom. C. Zofirlukast. Or D. Methylxanthine. The answer is D. Methylxanthine. Methylxanthine relaxes smooth muscles, including those of the bronchi, esophagus, and gastroesophageal sphincter. Question number 38. It acts by direct stimulation of MRC and indirectly through excitation of carotid aortic body chemoreceptors. A. Nicethamide. B. Doxaprom. C. Zofirlukast. Or D. Methylxanthine. The answer is B. Doxaprom. Doxaprom is a respiratory stimulant and an analeptic or CNS stimulant that is used to treat drug-induced ventilatory depression and apnea in newborn animals and humans. Question number 39. It stimulates directly the depressed MRC. A. Nicethamide. B. Doxaprom. C. Zofirlukast. Or D. Methylxanthine. The answer is A. Nicethamide. Nicethamide works by inhibiting potassium channels to cause stimulation of the peripheral chemoreceptors to increase respiratory drive. This effect occurs at lower doses than those causing more generalized CNS stimulation. Question number 40. Dogs and cats are given 1.5 milligrams to kilograms via IV dosage of Doxaprom. True or false? The answer is A. It is true. Question number 41. What dosage of Doxaprom is given to horses? Letter A. 0.5 to 1 milligram per kilogram IV. B. 0.5 to 2 milligrams per kilograms via IV. C. 0.5 to 3 milligrams per kilogram via IV? Or D, none of the above? The answer is A, 0.5 to 1 milligram per kilogram via IV. Question number 42. What dosage of doxapram is given to foals? A, 0.01 to 0.04 milligrams per kilogram via IV. B, 0.02 to 0.04 milligrams per kilogram via IV. C, 0.03 to 0.04 milligrams per kilogram IV. Or D, 0.04 to 0.06 milligrams per kilogram via IV. The answer is B, 0.02 to 0.04 milligrams per kilogram IV. Question number 43. What dosage of theophylline, a methylxanthine, is given to dogs? A, 5 milligrams per kilogram IM. B, 7 milligrams per kilogram via IM. C, 9 milligrams per kilogram IM. Or D, 11 milligrams per kilogram via IM. The answer is D, 11 milligrams per kilogram via IM. Question number 44. What dosage of aminophylline, a methylxanthine, is given to dogs? A, 8 milligrams per kilogram as loading dose and 5 milligrams per kilogram as maintenance dose via IM. B, 10 milligrams per kilogram as loading dose and 5 milligrams per kilogram as maintenance dose via IM. C, 12 milligrams per kilogram as loading dose and 5 milligrams per kilogram as maintenance dose via IM. Or D, 14 milligrams per kilogram as loading dose and 5 milligrams per kilogram as maintenance dose via IM. The answer is C, 12 milligrams per kilogram as loading dose and 5 milligrams per kilogram as maintenance dose via IM. Question number 45. What dosage of nicotinamide is given to dogs? A, 1 to 3 milligrams per kilogram orally, IV or IM. Letter B, 2 to 4 milligrams per kilogram orally, IV or IM. C, 3 to 5 milligrams per kilogram orally, IV or IM. D, 4 to 6 milligrams per kilogram orally, IV or IM. The answer is B, 2 to 4 milligrams per kilogram orally, IV or IM. Question number 46. What dosage of codeine is given to horses and cattle? A, 0.2 to 2 gm orally. B, 0.4 to 2 gm orally. C, 0.6 to 2 gm orally. Or D, 0.8 to 2 gm orally. The answer is A, 0.2 to 2 gm orally. Question number 47. What dosage of dextromethorphan is given to dogs and cats? A, 0.5 to 1 milligram per kilogram orally, 3 to 4 times a day. B, 0.5 to 3 milligrams per kilogram orally, 3 to 4 times a day. C, 0.5 to 5 milligrams per kilogram orally, 3 to 4 times a day. D, 0.5 to 6 milligrams per kilogram orally, 3 to 4 times a day. The answer is A, 0.5 to 1 milligrams per kilogram orally, 3 to 4 times a day. Question number 48. Dogs are given 0.02 to 0.1 milligrams per kilogram via subcutaneous of butorphanol. A, true. B, false. The answer is false. Question number 49. What dosage of hydrocodone is given to dogs? A, 0.15 milligrams per kilogram orally, 3 to 4 times a day. B, 0.20 milligrams per kilogram orally, 3 to 4 times a day. C, 0.25 milligrams per kilogram orally 3 to 4 times a day? Or D, 0.30 milligrams per kilograms orally 3 to 4 times a day? The answer is C, 0.25 milligrams per kilograms orally 3 to 4 times a day. Ipecac, a nauseant expectorant, is given through a dosage of A, 0.5 milligrams per kilogram, B, 1 milligram per kilogram, C, 1.5 milligram per kilogram, or D, 2.5 milligram per kilogram. The answer is B, 1 milligram per kilogram.